11 warning signs every woman should be aware of to spot early on breast cancer. With a 14% prevalence, breast cancer ranks as the main cancer-afflicting woman. Though the risk rises with age, this illness can strike women of all ages. Sadly, ignorance of the need of early diagnosis and treatment causes the survival rate for breast cancer to be much lower. The cancer has already advanced by the time many women seek medical attention, hence treatment is more challenging and survival chances are lessened. Still, breast cancer is a treatable illness. Early discovery is therefore essential to raise survival rates. Women who are aware of the warning symptoms and respond quickly will be able to identify early stages of breast cancer and increase their chances of effective therapy. We will go over the 11 red flags of breast cancer every woman should be aware of in this video so she may detect it early and take charge of her health. Simply said, we are not doctors. This video is solely for informative needs. See your reliable healthcare practitioner always whether you have any symptoms or uncertainty. Though individual differences abound, one of the warning signs and symptoms of breast cancer is aberrant cell development in breast tissue. Its development can be influenced by several elements including environmental, hormonal, lifestyle, and genetic ones. Though less frequently, men can also get breast cancer. New tumors can result from the cancer spreading to nearby tissues and metastasizing to other bodily areas. The need of frequent self-examinations is emphasized since everyone has different symptoms of breast cancer. Early detection of anomalies made possible by this lets timely intervention possible. Though they are not limited to one, possible signs of breast cancer include changes in skin texture or color, nipple discharge, variations in the appearance or sensation of the nipple, and inexplicable changes in breast size or form. A lump or hardening in the breast or underarm area is another. 1. Breast lump. The development of a lump in the breast is among the most often mentioned complaints of breast cancer. Usually painless, this lump is uneven in shape, solid to the touch. The mass could have different substance or feel than surrounding tissues. Though they can also be benign structures like simple glandular cysts, not all breast lumps point to malignancy. Still, any new or altering lump in the breast calls for medical examination to rule out malignancy. Should the lump be malignant, you could find that the skin covering it seems redder and is more sensitive than the surrounding breast area. Number 2. Lump in the armpit or collarbone. Less often discussed, but as important as a warning sign of breast cancer is the existence of a lump in the armpit or around the collarbone. This lump can develop when breast cancer cells move to the lymph nodes in these regions rather than always a direct result of the breast tissue itself. Given that the cancer cells are beginning to migrate outside the breast and into the larger lymphatic system, this course of the disease is grave. Unlike the more usually known breast lump, a lump in the armpit or collarbone could feel firm, immobile, and occasionally sensitive to the touch. Fascinatingly, this symptom may show up before a discernible lump in the breast occurs. Hence, it is an important sign to be aware of during self-examinations. Finding a lump in the armpit or collarbone can be frightening, much as with a lump in the breast. Still, always keep in mind that early discovery and quick response greatly raise the likelihood of effective management of breast cancer. Number 3. Swelling in the whole breast. A rare but aggressive type of the disease, inflammatory breast cancer can cause swelling all over the breast. It is especially important to be mindful of physical changes since this issue might not be found on a normal mammography. One of the IBC symptoms is a sudden change in breast size that clearly results in asymmetry. Comparatively to the other breast, the afflicted one might get red, itchy, warmer to the touch, and might feel painful or heavy. Known as peau d'orange, an orange peel texture can also be experienced on the skin. Although these symptoms could point to IBC, less major diseases like mastitis or a breast infection can also be blamed for them. Still, any ongoing variations in breast size or texture shouldn't be discounted. Number 4. Sudden variation in breast size and shape. Another early indication of breast cancer is a rapid change in the size and form of one or both breasts. A lady could find one breast seems heavier or bigger than the other. One can also have a burning feeling or notice that the breast has gotten bloated or reddish. These developments might happen fast and without a clear origin. Although one's breasts may vary somewhat in size, a clear and abrupt change is not usual and should be checked out more closely. Breast cancer can physically modify the structure of the breast cells. Ignoring these symptoms or blaming aging or hormonal changes could perhaps postpone a critical diagnosis. Being alert about such developments helps to open the path for early breast cancer detection and treatment. Number 5. Skin reactions. Another sometimes missed early indication of breast cancer is skin discomfort. On many areas of the body, including the breasts, dryness and itching are natural occasionally. On the other hand, persistent itching or irritation of the breast skin that does not go away with moisturizers or lotions may point to breast cancer. Often, rather than being distributed over the whole breast, skin irritation brought on by breast cancer is concentrated in one location and relentless. Like the skin of an orange, the skin could also seem pitted or scaly. This may indicate inflammatory breast cancer, an uncommon but severe kind of the disease. Remember, early detection of breast cancer makes treatment easier, so avoid ignoring ongoing skin irritation. Number 6. Dimpling over breast skin. Dimpling of the breast surface is an odd indicator of breast cancer presence. This describes a disorder whereby the skin covering your breast seems puckered or uneven. The dimples could be more evident or subtle and difficult to find. Commonly known as podorange, this symptom might arise from the breast tissue swelling brought on by a malignant tumor's existence. Additionally visible around the breast, and the nipple is flaky, scaly skin. Wounds with black scabs could also be another relevant indication. Especially when nursing, dimpling could be misinterpreted as a sign of inflammation or an infection. Number 7. Breast or nipple area pain. Although women often have sporadic discomfort or pain in their breasts or nipples, particularly during their menstrual cycles, persistent and inexplicable pain might be a warning indication of breast cancer. While many breast tumors are asymptomatic, a small group may cause regular discomfort. This pain could be more dispersed, or it might be limited to one part of the breast or nipple. The type of the pain can also change. It might be a subtle ache, a sudden stabbing pain, or a scorching sensation. Although other non-cancerous diseases, including mastitis or fibromas, can also cause breast or nipple discomfort, it's important not to overlook ongoing pain. Recall that a careful inspection is required to ascertain whether a benign or maybe malignant ailment is causing the pain. Number 8. Breast vein visibility. Visibility. The more visible veins on the breast is one less known indication of breast cancer. When a vein gets swollen or inflamed, a condition sometimes called superficial thrombophlebitis results. Veins often grow more noticeable with aging, heavy exercise, bruising, wearing a tight-fitting bra, or following surgery. On the other hand, a new conspicuous vein devoid of clear explanation should raise concerns about breast cancer. This is so because malignant tumors can disturb the usual blood flow in the breast, swelling the veins and increasing their visibility. Number 9. Any discharge from the nipple. While most nipple leakage is not cancer-related, in women who are not nursing, it can occasionally be a sign of breast cancer. The discharge could seem milky, yellow, green, or clear in color, and its consistency could be thick or thin. Sometimes the discharge also exhibits blood-streaked characteristics. Nipple discharge can be caused by several forms of breast cancer, including invasive ductal carcinoma and ductal carcinoma in situ. But discharge can also result from non-cancerous disorders, including an abscess or ductectasia, inflammation, and blockage in the milk duct. Nipple discharge could also result from adverse effects of some drugs or hormonal changes. Number 10. Nipple retraction or inversion. A change in the look of the nipple, including retraction or inversion, can point to breast cancer. When a nipple turns inside or becomes pushed in instead of projecting outward, a condition known as nipple retraction results. A tumor under the nipple can do this by dragging on the tissue and inverting the nipple. Although some people have inverted nipples, a healthcare expert should investigate a rapid change in the look of the nipple. Number 11. Heat or redness inside the breast. Especially in inflammatory breast cancer, unusual redness or heat in the breast might potentially point to breast cancer. The breast may get red, puffy, and heated to the touch from this uncommon but aggressive type of cancer. Usually accompanying these symptoms are a sensation of soreness or heaviness. Although infections or other non-cancerous diseases might also be linked to such changes, persistent redness or heat in the breast should be evaluated by a medical practitioner. Any woman can be threatened with breast cancer, which is rather common. Every woman should be alert about her breast health and include routine mammograms and self-examinations into her treatment. Though this material should not be regarded as medical advice since we are not doctors. This video is just for informative needs.